We're here today to interview Elizabeth McGee, author of the book Worry-Free C-Section and a Two-Time C-Section Mom. Elizabeth's book is available on Kindle at Amazon.com and also from her website, worryfreecsection.com. By the way, with a website purchase, you'll not only get the book, but you'll also get several bonus books and the toolkit. Elizabeth, welcome to the program.
Thanks, Jeff. I'm glad to be here.
Well, I read your book, and I just want to say that there's some pretty powerful information there. So let's get right into it, Elizabeth. Why did you write the book?
Well, I wrote the book because I wanted to inform women that no matter how perfect their pregnancy is, there's a chance of having a C-section. Hopefully, you never have to experience it, but I was one of those people that had a perfect pregnancy. I exercised, I ate well, I felt probably better than I'd ever felt in my whole life. Yet I had a C-section, and it was a discouraging moment. It was not only discouraging, it was scary, and there's a lot of emotions that go on there. So I wanted to write the book to help alert women that, even though you have a perfect pregnancy, you could have a C-section, and you might want to prepare yourself for it. There are, certain things that you can do to help prepare, but and that's basically why I wrote the book, is to try to help women understand that it is possible and that being prepared can really be a lifesaver and it's something that you're not sure about, you're not aware of.
Okay. So now, what was the hardest part about having a C-section?
Well, probably the hardest part was the surprise when I didn't expect it to happen. Consequently, the fear of not knowing what would happen. I was afraid of the dangers to the baby and to myself. What did that mean to my baby? Things that ran through my mind were death, basically. My baby could die or I could die. The recovery was very difficult. I had no idea what to expect with that. There was a lot of issues that came up with recovery, like, the pain for one thing, and having to deal with taking care of a newborn baby. Very difficult. I had trouble breastfeeding. My incision hurt all the time. I never was quite sure whether I had an infection or whether what was going on with it was normal. So there was a lot of things to get used to, a lot of things that I hadn't been prepared for.
With that being said, what would you say would be the most important thing that a woman should know if they find themselves in that situation where they have to have a C-section?
Well, first of all, don't panic. C-sections are safe surgery, and they don't necessarily mean disaster. But the other thing you might want to understand is that not all C-sections are necessary. So you really need to kind of do your homework before you have a C-section. Understand what the risks are, why they happen, and why your doctor would recommend it. And if your doctor does recommend it, you need to be ready with confronting him with alternatives. Why other alternatives would be right for you, and can you have those alternatives? And anytime your doctor tells you something that you don't understand, always make sure you get the answers. Make sure you do understand.
Okay. So one of the things I've heard about C-sections is that they have very high rates these days. Is that really true that they're that high?
Yes, Jeff. The C-section rates are very high. In fact, in the U.S. alone, there are 4 million childbirths each year. And of those 4 million childbirths, 1.4 million end in a C-section. That actually equates to over 30% of C-section births in this country. And of course, that number is rising yearly.
Wow. Why do you think those numbers are so high?
Well, there's a number of things. First of all, there's legal issues. Doctors don't want to be sued, so if there are any complications in the pregnancy, the doctor may determine that a C-section is best. Again, if you do your homework, you may discover that C-section is not the best, but doctors are going to go with what's legally right for them. The other thing is there's a fear of childbirth. A lot of women fear the pain of childbirth, and they feel that a C-section will help them get around that pain. Although I never really understood that because you might not have pain at childbirth, but you're definitely going to have pain in the recovery. My book, I give you a lot of suggestions and ideas on how to relieve pain and how to deal with pain. But nevertheless, I mean, it's still a difficult situation. Any surgery is going to hurt, especially immediately afterwards. And the other option is, or the other reason why might be time schedule. A lot of times women, they want to have their baby's birth on their birthday or something, on a particular birthday or a particular holiday. I know January 1st, 2000 was a big day for baby's birth, and a lot of women had C-sections scheduled because they wanted to make that turn of the century. So, it's, just kind of sometimes a preference of the woman.
Okay. Now you said your first child, well, the first C-section you had was a surprise, and that most women don't expect to have a C-section. So I would imagine it's hard to prepare for something you don't even expect to happen. So how would you suggest that a woman prepare?
Well, first of all, you need to do some of your own personal research and educate yourself. Understand why a C-section occurs. Know the reasons. And for example, inducing labor has a high rate of C-sections. So you might want to avoid that. If your doctor says, well, I think it's time to induce, or I think, you're nothing's happening, maybe we should induce. You might want to say, no, I don't. I think I'd like to wait that one out. So do your research there. Find out why the C-sections occur. Find out the risk. Then find out what actually happens in a C-section. I mean, if your doctor all of a sudden says you're going to need one, well, a lot of things are going to happen. You're going to have catheters. You're going to have an anesthesia. What are the anesthesia options? You have a choice there. Otherwise, you're at the mercy of your doctor and the hospital to tell you what's going to happen. So, by preparing, you have the upper hand. You can drive the bus. You can have things happen the way that you want them to happen. And the other thing is to create a birth plan. I highly recommend creating a birth plan for vaginal birth or C-section. Always have a birth plan in place and have a clause in your C-section, in your birth plan that talks about what type of anesthesia you want, when you want to begin to breastfeed, what type of pain medications would you prefer versus other pain medications. And these might be all things that you want to talk to your doctor beforehand and get a good grip of what you want. A good idea of what you want, and then just put those things into a birth plan.
So Elizabeth, in your book, you talk about long-term health risks and complications that are associated with C-sections. So could you kind of go over some of those for our audience?
Sure. There's a three that stand out most in my mind. The first one is emotional scars, especially for women that didn't expect to have a C-section, were all set on a vaginal birth. There are some emotions that come into play there. Anger is one because you had a C-section and didn't want that. You wanted a vaginal birth. So, and then of course, the emotions that you go through when you get home as well in the recovery. You're not feeling good. You're tired. You're fatigued. And why did this have to happen to me? Why couldn't I have a vaginal birth? So you have all those kinds of emotions going on. But let me just say, though, one thing that does help you get over the emotional scars and the emotional trauma is to plan. If you're all planned to have a C-section, I mean, this doesn't necessarily say that you're going to have one, but you're ready to have one. So you know what to expect. You know what to do. You plan for your recovery. That goes a long way in helping your emotions. The second thing is adhesions. The C-sections are noted to cause adhesions. Actually, any type of abdominal surgery will cause adhesions. Adhesions are basically the scar tissue that grows underneath your incision. And it's just part of the healing process. But these adhesions are fibers that grow as your incision heals. And these fibers can get like long and lanky, and they can get inside and adhere themselves to other tissues and organs. And when that happens, there's often a lot of pain associated with that. And if they adhere to your organs, you can have things, abdominal pain and obstruction and things like that. Now, not everyone has trouble with adhesions. Everyone has adhesions to some point, but not everyone has problems with them. But for many women, a large number of women actually, adhesions can cause a lot of pain and discomfort. The other thing about the risk of C-sections are for your future pregnancy. It's not so much today. There used to be a saying, once a C-section, always a C-section, and that's not necessarily the case today. However, there are a lot of doctors and there are a lot of hospitals that are very conservative, and they feel that once you've had a C-section, you will always have a C-section, and that's due to the risk of abdominal rupture. Once you've had a scar, once your body starts expanding, that scar can rupture, and once you have rupture, that can be very dangerous to you and your baby. But actually, the risk of rupture, uterine rupture, is very small today. It's really only 1%, even a little less than 1%. So I think we're finding more and more VBACs happening today, but you still are likely to get pressure from a doctor and hospitals to continue with your VBAC. And of course, I cover these things quite a bit more within my book, so there's a lot more information that I could cover here, but we only have a short amount of time.
So wow, these adhesions can really be that bad, huh? I mean, is there anything that you know of that can be done to avoid them, prevent them?
Well, no, actually, adhesions are going to occur. Like I said, it's part of the having abdominal surgery. However, there are some preventive measures, and I talk about those in my book, and you can consult with your doctor, but there are things like adhesion barriers that doctors use today, and there are some surgical techniques, and there's several of them, so you might want to talk with your doctor about them. As far as therapy, once you have adhesions or problems with adhesions and pain and things like that, there is some massage therapy that you can do as an afterbirth type of thing now too, and I discuss some of that in my book, but those things have helped a lot of, massage therapy has helped a lot of women, especially relieve the pain and discomfort of adhesion.
Okay, well, we're out of time, and I want to thank you, Elizabeth. You've been a wonderful guest, and thank you for coming.
Well, you're welcome, Jeff. I've enjoyed being here. Thank you.
Well, that brings us to the close of the program. For all our listeners, be sure to stop by the Worry-Free C-Section website. There's lots and lots of great information out there for new moms. And thanks for listening.